Sim, podem começar.
Boa tarde a todas e todos. É com muito
Good
entusiasmo
afternoon,
que
everyone.
acolhemos todos os
We are
participantes
very
deste webinar
happy
com o
to
tema Dose Padrão
have
de
all
Álcool
the
no Brasil,
participants here
avanços e
for
desafios
this
para a prevenção
webinar,
do uso do
the
álcool no
standard
país.
drink of alcohol in
Informamos que este
Brazil,
webinar
advances
está
and
sendo
challenges for the
gravado
prevention
e
of the use of
transmitido em
alcohol
tempo
in the
real no canal
country,
do YouTube.
reminding you
Terá
that this
opção
is
de
being
tradução de língua
recorded and it's
estrangeira
being
no
shown
inglês,
live on
português,
YouTube, and it has
português
the
e inglês.
interpretation option
O
for
objetivo
Portuguese
deste
English and English
webinar
Portuguese.
é
The
apresentar a
objective
nota
of this
técnica
webinar is to
conjunta
present
que
the
traz uma
joint
análise
technical
abrangente
note
sobre o
that brings
panorama do
a
consumo de
broad
álcool no Brasil,
analysis of the
seus
panorama
impactos
of
em
alcohol
saúde
use in
pública
Brazil,
e a
its impact
definição da
in
dose
public
padrão.
healthcare,
Visa
and the
também
definition of the standard
disseminar
drink. It also
informações para
aims to
subsidiar
disseminate
políticas
information to
públicas,
subsidize public
prevenir e
policies to
reduzir danos
prevent
do
and to
uso de álcool.
reduce the damage of
Sobre a
alcohol
dinâmica
use.
deste
About
webinar,
the
teremos
dynamics of the
inicialmente as
webinar,
falas de
we will
abertura.
have the
Na
opening
sequência,
remarks,
assistiremos às
then we
apresentações
will watch
técnicas a
the
respeito do
technical
assunto
presentations
e
in
após
regards to the
teremos
subject, and
comentários e
afterwards we will
reflexões
have
de
commentaries
especialistas de
and
instituições de
reflections
pesquisa
of
e
specialists
academias e
from
parceiros.
research institutions,
Cada palestrante
academia, and
terá 7
partners.
minutos para expor
Each
e
speaker will have
após
7
abriremos para
minutes to
responder as
speak, and then
perguntas
we
e
will open
comentários
up
do chat,
for
onde todos
comments and
poderão
questions from the
participar, se
chat, where
identificando
everyone
e
will be able to
direcionando as
participate,
perguntas.
identifying
Bem,
themselves
para a
and
abertura
asking
deste webinar,
questions. To
convidamos
open
para
this
fazer
webinar,
uso
we
da
would like
palavra
to
a
invite
senhora
to take the
técnica do
floor
Departamento de Saúde Mental,
from the
Álcool e
Department
Outras
of
Drogas,
Mental Health,
Márcia
Alcohol, and Other
Aparecida de
Drugs,
Oliveira,
Márcia
que
Aparecida
estará
de Oliveira.
representando a Secretaria de
She
Atenção
is representing the
Especializada do Ministério
Secretariat
da
of
Saúde.
Specialized Care from the Ministry of Health.
Doutora Márcia, com a palavra.
Dr. Márcia, the floor is yours.
Obrigada, boa tarde.
Thank you very much.
toda
Good
gente.
afternoon,
É uma
everyone.
honra estar aqui hoje
It's an
nesse,
honor to
nesse
be here
evento tão
today
importante,
at this
tão
very
longo,
important
né,
and very
Letícia?
long
Já teve
session
aí
and day. We have
anos,
worked on this
tenho
for
alguns
a lot of
meses de
time.
trabalho intenso
We've worked
nosso
on
para que a
months
gente pudesse estar aqui,
tirelessly so
no
that we
dia
can
de
be
hoje.
here today.
Vou ser breve para que a gente possa
I will be
escutar
brief
os
so that we
colegas,
can
então
hear
dar
our
boa-vinda a
colleagues.
todos,
So I would like to welcome
todas,
everyone.
No sentido de que essa nota técnica
And
que
this
foi
technical
conjunta
note,
e que recebeu
this
o
joint
número
technical
de
note that received the number 263 of
ela,
2024,
capitaneada pela
it's
Secretaria
captained
de
by the
Vigilância em
Secretariat
Saúde e
of
Ambiente,
Surveillance in Health
pela
and
Secretaria
Environment,
da Atenção Primária à
or the
Saúde.
Secretariat of
Nós,
Primary
aqui da
Health Care.
Secretaria de
We
Atenção
hear from the
Especializada à
Secretariat of
Saúde,
Specialized
e,
Healthcare,
que tratou então da definição da
dealt
dose
with
padrão
the
de álcool no
definition, or will
Brasil.
deal
Para nós da
with
saúde
the definition
mental,
of the
ela
standard dose
tem
in
uma
Brazil.
importância
For us in mental
significativa,
health, this is
por
very
diversas
important for
razões em
various
relação à
reasons
nossa
due
população.
to our
Uma
population.
dessas razões,
One of these reasons
primordial, chegando até a ponta, é o entendimento
is the understanding
sobre o que constitui então a
about
bebida
what
alcoólica em
constitutes
termos
an
de
alcoholic
quantidade
drink
e
in
efeito,
terms of
no
quantity
sentido de
and
ser mais
effect,
fácil para que a gente possa
so that it is
implementar
easier
campanhas
to
de
implement
prevenção
campaigns
e de
for
educação
prevention
junto à nossa
and
população.
education for our
E isso,
population.
gente, contribui
And this, everyone,
significativamente, né, para a
significantly
melhoria
contributes
da
to the
saúde mental
increase
da
of
nossa
mental health care
população
in our
e,
population,
sobretudo, para a
and
formulação
especially
das
for the
políticas
elaboration
públicas
of
em
public
relação ao
policies
álcool,
in
políticas
regards to
essas mais
alcohol,
eficazes,
so that we have more
também,
efficient
no sentido
and
de que elas
efficacious
possam ter
public
controle
policies,
do
so that they
consumo
can
do
also
álcool,
control the
no
use of
Brasil
alcohol
e
in
que
Brazil,
também isso possa melhorar,
and
sem
so
dúvida,
that this
o
could
cotidiano e a vida
improve
das
the
pessoas.
day-to-day and the life quality of these
Fornece
people.
ainda para nós,
It
né,
also
uma
provides us
referência
with
clara
a
para os
clear
profissionais
reference
da
and
saúde
benchmark
ao
for healthcare
tentar
professionals
abordar de uma
when they
forma
try to
mais clara os
approach
fenômenos
these
relacionados ao
phenomena
consumo do
related
álcool
to alcohol
e
consumption.
também uma maneira
And
importantíssima
it is also a
que
very
foi essa
important
nota
way that this was created, because this technical note was based on the best evidence, the best scientific evidence that we were able to raise over these last few months. This technical note, it also helps to reduce by a lot something that the WHO has always requested us over the years, which is the reduction of the stigma in regards to the use of alcohol. So this note also helps to reduce this stigma associated to people that deal with problems related to alcohol use, which contributes a lot to us so that we can help provide people with help and support. This is very important in our work and policy. Beyond that, the definition of the standard alcohol drink can also be integrated, and it can be one thing that we have spoken about a lot over the last few months. It can be integrated to other public healthcare policies, not only in regards to mental health, but also in regards to nutrition, the prevention of communicable disease, or chronic diseases, and especially something that I always repeat, which is in the gestation period of women in regards to fetal alcohol syndrome. And this will help us a lot to mitigate once and for all fetal alcohol syndrome. So this produces an approach that is more than comprehensive for the population's healthcare. And to conclude, this technical note 263/2024 is a very important step in the construction of a more aware population about the consumption of alcohol and its effects on mental and physical health, while establishing for us clear guidelines based on evidence that can contribute to the promotion of mental health care, the prevention of diseases, and in the improvement of the life quality of our population. Thank you very much. I wish everyone a great event, and I hope to hear during this moment that we are together, I hope to hear all of the challenges that we are facing ahead of us. Thank you very much. Thank you very much, Dr. Marcia, for being here with you and for your opening remarks. Now, we would like to pass the floor to the Director of the Department of Prevention and Promotion of Health, Gilmara dos Santos. She is representing the Secretariat of Primary Health Care. Dr. Gilmara, the floor is yours. Good afternoon, everyone that is watching us. Good afternoon, Letícia Cardoso, and especially thank you for leading this construction process in this joint effort that involved the secretariats from the ministry, representatives from academia, representatives from institutions that act on this agenda and in the qualification of the promotion and prevention or healthcare promotion and prevention policies, focusing, of course, on our agenda for prevention of alcohol use by users, especially working with these users that are in our unified healthcare system. Thank you very much, Marcia, for the partnership. And Marcia immediately said how important it was, the year of 2024, for us to finish the year by creating this joint note, and how important this intersectorial relationship is. And we also have our colleague here, Roberto Gil, who is from INCA, and they are also a partner of ours. So the joint note already brings us a very important element, which is necessary to highlight in the management of our minister, Nízia, to act based on the best evidence available. So this is an excellent note where we present the best evidence, the studies, and what is important to communicate in the field of prevention and control of alcohol use for public policies. And the biggest highlight is how much the use of alcohol generates risk for health. And so we can start with the debate and the call of our unified healthcare system. So we really need this note, and we have to have a dialogue about these subjects. And representing our Secretariat of Primary Health Care, we have more than 5,000 teams of primary health care in this territory that appropriate themselves of our public policies and try to see the cross-sectional aspect in the day-to-day life. So this is very important, and to have all of our partners here, including PAHO, to start to think about a communication strategy as well for the professionals and also the users. And then the technical note brings this very clear in one of its items: what represents a standard drink? What are the recommendations from the Ministry of Health and the WHO and PAHO, and how we can have a dialogue in the territory based on these actions? So this is very important. And then Marcia strongly highlighted how our agenda is cross-cutting with various other policies. So we can highlight our national healthcare promotion policy, and it recognizes the social determinants. So this way of living that the evidence of alcohol shows us, we know that these are subjects, most of the cases they are male, in an age group that is increasing, but it also cuts through the younger population. And it has a perspective of taking a look at these damages and to see them more related to the use of alcohol and the risk of healthcare. Also, people that are in vulnerable states, and at the same time where we have men with a high level of education that also use alcohol. So this is a challenge. Alcohol and its subject, it surpasses all these different layers, and they are associated to different determinants. So to bring this prevention of healthcare promotion, the policy of healthcare promotion is very important. And in the beginning, I talked about our intersectorial agenda as well. And the strengthening of this agenda with all of these subjects from the Ministry of Health is very important. And then, of course, also our intersectorial agenda, because we need a partnership in our territory of the areas, different areas of the government, and also from civil society and the territory. So it reminds us to bring some important elements, such as popular or community surveillance and the communication of surveillance with primary health care. And then Marcia said, well, that our network has to be more and more qualified and integrated, aiming at this line of care, especially focusing on the people that use alcohol. And I think that this brings some context to our speakers, because it will bring elements and will detail what in practice this note is going to represent. It brings strategies that will be used in our day-to-day activities, but there is also something that Marcia and Letícia is very important. When we say that primary health care says, believes, and reinforces that it is a coordinator and an ordinator of this network, so it has to be very attentive to this agenda of prevention and control, and then making this cross-cutting element with the policies, for example, the nutrition policy, the alcohol and drug policies, and various other policies, and the specialized care policy as well, and the surveillance one as well, because we have to take a look at surveillance and bring this to the day-to-day activities of these teams. So the energy that we have here, it will be also a part of their lives. And when we visit the informational system of basic healthcare to make a relation with all the studies that we present in the note, there is a production in a day-to-day basis. So in 2024, I'm just bringing some data points real quick so that we can use them in the debates, and so that we as an interfederation with the ministries, the municipalities and states and all the network of partners that we have, we can think about how we can take a look at these single public policies and produce, because we are creating a lot of interesting information. Last year, we had 840,000 specific consultations with alcohol users. We had all these individual examinations or consultations. These users that went to the basic healthcare unit, and having this relationship with these people is very important. From these 840,000 consultations, most were men. So it was only 23% that were women. And when I take a look at this care, at this dialogue, and this agenda of prevention, which is interdisciplinary and multi-professional, we have 54% of these consultations, 59% of these consultations done by the doctors, 24 are done by nurses, so we have 8% by social assistants, and 7% by psychologists. So I'll already throw this out there that we have this battalion for the primary healthcare and prevention teams. We have these powerful teams with intersectorial perspectives, and we have to think about strategies of how to approach and talk about alcohol in this agenda of the risk factors. And we have in the technical note which diseases have a relation with this. And this risk of some diseases, including the cardiovascular diseases, cancers, and other ones. I'll leave these to Gil to talk about the importance of this note for us to be able to advance as well on the agenda for the national policy of cancer control. And at our secretariat, we have a lot of collective activities. So in 2023 and 2024, considering all the collective activities together with the public that we have carried out, we had 85,000 activities with more than 1 million participants. So there is a production. We are able to see this in the scope of Brazil, and we are even able to regionalize this. So we can say that the note will give us even more possibilities to be closer to these users, to know them, and to have a dialogue with the prevention agenda, and so that we can produce even more activities. When we take a look at the collective activities where we have topics, and when we take a look at these topics, and we have chemical dependency, tobacco, and other drugs, because our agenda, of course, is also related to these risk factors, we had 134,000 collective activities involving 2.6 million participants. So there is a magnitude, which is an absolute piece of data that I can bring you here, and we have to improve and invest in this, but this note puts this on a priority agenda, and it will bring us a lot of possibility to drive various elements: communication, integration, and to see how we can tackle, because I think tackle is the right word, to advance on this subject, to reduce by 10% until 2030 the consumption. So it does show us a great challenge for primary healthcare. And I would like to say as well that we started, in light of the discourse or the dialogue, just like President Lula said, this year is a year of harvest. So we can work together this year with all the networks of surveillance and specialized healthcare and the unified healthcare system to promote healthcare and life quality for people. So I am very happy. This webinar is going to be a success. And Letícia, we are working more and more together in this Ministry of Health, together with all of our partners in the territories and all the municipalities. So a great 2025 for everyone here. Even because I didn't even have the opportunity to give Letícia or Márcia a hug this year. So I wish everyone a lot of success in this activity, and we will be here together with you in the building and the drive, because this technical note has to reach the front lines of the healthcare professionals. So thank you very much, everyone. Thank you very much, Dr. Gilmara, for your words and your availability of being here with us today. Now we will hear the consultant, João Ribeiro Vieira, from the Pan American Health Organization, representing the Pan American Health Organization. Dr. João, the floor is yours. Good afternoon. First of all, thank you very much for the opportunity. On behalf of Dr. Socorro, I would like to thank you for the opportunity to have PAHO participate in this very important opening panel. Well, alcohol is this product with psychoactive effects, and that historically has a cultural connection with various cultures, including Brazil. Since the beginning of the sugarcane production, we had the production of cachaça, and I like to draw our attention to this because tobacco was also a topic that historically was very connected, and the tobacco leaves were even present in the national flag at the time. And today, it is not a part of our day-to-day life anymore, even because it was duly tackled and it changed the collective mindset in regards to this product, and we identified the evils of this product. So at the same time, or the same way that we worked with tobacco, we can also evolve in a sense of transforming Brazil, which is a great player in the tobacco field, to also be a great player in the alcohol field. It's also important to draw attention to the fact that alcohol is a great problem, not only in public health care, because it incorporates various diseases, but it also produces a social and economical burden. The consumption of alcohol, for example, is associated to more than 200 diseases and types of injuries. And around the world, we have more than 3 million deaths around the world in a year due to the effects of alcohol, which represents 5.4% of all the global deaths. It's also important to draw our attention to the fact that alcohol is associated to the risk of developing behavioral disorders, problems in regards to dependencies, and non-communicable serious diseases such as cirrhosis, various types of cancers, cardiovascular diseases, and outside of the spectrum directly related to healthcare, we also have the impacts that come as a result of use of tobacco, such as domestic violence and traffic accidents that are also very expressive. Another very important point to highlight is that alcohol currently is very associated to the issue of infectious diseases. So the use can give way to TB and others, and as was mentioned, if it is used by, it can be used by pregnant women, and then it results into fetal alcohol syndrome or premature births.
This technical note, perhaps its most important aspect is that it is a joint note. It represents the efforts of three secretariats doing a work of excellency that shows how we can work together. This perspective of looking at the different secretariats and tracing an integrated action. But also, this joint note is inserted in a bigger umbrella of actions. Last year, we had a great victory in approving the tax reform, incorporating selective taxes, including the taxation of alcohol. And this is another extremely important point in the process of the set of actions that Brazil has been taking so as to move forward with combating alcohol and its expressive social impact. Well, So as not to go over my time, I will stop here, but I emphasize that PAHO is at the disposal of the Ministry of Health, the Brazilian government, and we are always at your disposal to collaborate with all necessary measures to tackle this public health issue. Thank you. Thank you, Dr. João Ricardo Vieira, for your words, for being here with us, participating in this moment. And we now invite the General Director of the National Cancer Institute, Mr. Roberto Gil. Good afternoon, everybody. It's a huge pleasure to be here with Teresa, Letícia, Márcia, João, Gilmara, my friends. And I would like to congratulate SVSA for this initiative through Daenche. I think it's fantastic that we are defining a standard drink dose. And this is a very important point because we stop thinking in terms of light or heavy drinking. And it's fundamental that we have a definition based on which we can draw public policies. And this is very important for the National Institute of Cancer because alcohol is very important. We are always associated through SAIS to all secretariats. And as was said here, the Ministry of Health has been behaving as the Ministry of Health and having health promotion as a fundamental aspect. We live in a society that banalizes exposure to risk factors, so we currently have a deeper perception because it's not because we live more that we live better. We currently have non-communicable diseases currently established as the main causes of death in the population. And alcohol, I remember that the first time I had in contact with a study that measured the impact of cancer, it was responsible for 17,000 new cases of cancer and 9,000 cases of death. This was in 2012, and between 2013 and 2019, we doubled the consumption of alcohol in women and in males and quadrupled in women. So these terrifying numbers from 2012 are probably much higher than that. And it's not just a health issue, it's also an economic issue because the spending involved with direct training that we currently have in the public health system are in the order of 81 million, an increase of 149%, reaching over 200 million by 2030. If we maintain the current behaviors, which is neglecting alcohol as a risk factor, of course, it's a complicated issue. 9 out of 10 people in the public health system currently declare that they consume alcohol. And we always say in the Cancer Institute that there is no secure alcohol dose. And we are going through a moment in society where any attempt to build public policies, do prevention or regulation or impart knowledge in terms of risk factors, we always come across those who try and say that the state is being authoritarian, that society can regulate itself. And we know that there are other interests from economic interests involved in each one of these circumstances, the so-called economic determinants of diseases that should be tackled. I'm very happy to be here with you, and this note is a first step in the sense of alerting to this problem and taking on this commitment of possibly also tackling alcohol and its harmful impacts like we did with tobacco, and achieving huge victories and once again putting Brazil at the forefront in Latin America in the development of efficient public policies that reduce exposure to risk factors for chronic diseases and many diseases. And as Dr. João said, I remember the people that I really admired, like Milor Fernandes, were against the use of the seatbelt. They thought it made no sense for us to make the use of the seatbelt mandatory. And when we had the policy of zero tolerance of alcohol when driving, people said, oh, this is absurd because people could have not drunk that much. And we saw the impact that this had in mortality. So I'm very happy to work with all of you. Thank you very much. I think this is an event where we can show many of what we have produced here. And this is a topic that's very interesting for us. Unfortunately, I won't be able to stay until the end, but I want to say that other people in INCA are also here, and I'm always happy to be with you. Dr. Roberto Gil, thank you very much for your words and for being with us in the opening session of the webinar. And like we mentioned, the goal of this webinar is presenting the technical note that brings an encompassing analysis about the panorama of alcohol consumption in Brazil, its impacts in public health, and the setting of a standard drink. And we now invite the director of the Department of Epidemiological and Non-Communicable Diseases Department in the Ministry of Health, Letícia Cardoso, to make her opening statements and present a technical note that was drafted jointly, Technical Note 263-2024, that was drafted jointly with the technical areas of the Secretariat of Surveillance and Health, Primary Healthcare Secretariat, and Specialized Secretariats. Letícia Cardoso, you have the floor. Thank you, Cris. And first and foremost, I'd like to greet all of my colleagues in this opening panel, Dr. Roberto Gil, Dr. Gilmara, my dear Marcia, João, representing Dr. Socorro Gross from PAHO, who also supported us technically in this collective construction. And I'd like to say how happy I am. We know that this was hard technical work, but also political work, because it is a topic that's hard for us to address in public health and in health in general. But we were able to publish a technical note with the colleagues from the secretariats, and it is a note by the Ministry of Health. We're all part of the Ministry of Health. It is an official recommendation by the Ministry of Health, and we are going to go into the details and I'll present it further. But first, I'd like to greet you all and thank you for participating in this collective construction. Thank you to the team of researchers who worked with us in the drafting of this note, helping in the decision and providing the most current evidence available so that we could draft it. Thank you, PAHO, PAHO Brazil, PAHO DC, who collaborated with us in doing this technical work. And also, thank you to the organized civil society as well, because they have a long-standing experience in thinking about strategies to translate that knowledge. So we have some challenges, like Gilmara said, the decentralization of this knowledge in a unified health system that's present in 5,500 municipalities with so many different healthcare teams, both in primary healthcare and also in specialized healthcare. We have the challenge of denaturalizing in society the consumption of alcohol as something that is not that harmful, that may be even beneficial. So we need to deconstruct a narrative, and we're going to have to learn a lot from what we did with tobacco. So we're going to have to build very effective communication strategies, and we have some challenges ahead of us. We also need to think that this note is a first step for the construction of other public policy and regulatory measures. Here, we're not talking about a health system that blames the individual. We're talking about a public health system that supports decisions, support information, and that provides evidence-based information to prevent harmful practices and promote the health of the population. So with these opening words, I will begin my presentation, and here I wanted you to tell me if you can see my screen, my presentation, because I can no longer see you. Yes, we can see your screen. So my role here today is to bring, in the name of the Ministry of Health and all secretariats and organizations involved, the content of this joint technical note, Note 263 from 2024, and it brings two very important points: a central message in relation to the consumption of alcohol as a public health issue. We bring magnitude data and impacts to the health and economy in the population. And we also bring a term that may even be used to confound the population, but I will further clarify what the standard drink term means. That is the definition of how much is a single standardized measure for alcohol that we can work with in public policy. What are the
no país. Então, ela aponta nessa direção esse segundo conteúdo importante que tem na nota. Então, como breve contextualização, o João já
note addresses, and as a matter of context, I'm going to bring some other numbers. It is a serious public health issue in Brazil and in the world, and it is responsible for 5 million deaths, according to studies about the global load of diseases, and 2.5% of the global load. It is due to the consumption of alcohol. 3% of deaths in all ages were attributed to the consumption of alcohol in the country, and many people died because of the use of alcohol in 2023. In Brazil, 2 people die every hour because of the consumption of alcohol, so it's not a rare event as it is often claimed. It is a risk factor for chronic non-communicable diseases. Chronic non-communicable diseases are the main cause of death and diseases in the world and in Brazil. In 2024, we lost 700,000 people to these diseases that cause loss of productivity, high costs for health, impact health and public coffers, and the economic development of the country. According to the PNS of 2019, 80% of the Brazilian population had at least one diagnosis of non-communicable chronic disease, according to the research done with the population. It is a risk factor for cancer. It is a group 1 cancerous substance, which is the highest level of risk, so we cannot it is a cancer substance just like tobacco. So it is something that we need to look at as managers, as opinion makers in the field of health. It has a causal relationship with oral cavity cancers, cancers of stomach, rectum, larynx, and breast cancer. So there is no safe standard to ingest alcohol, and the ingestion of any amount of alcohol is related to some level of risk, according to the WHO, after a wide literature review. It is also, like Marshall mentioned, a risk factor for behavioral disorders. It includes a set of conditions that go from acute intoxication due to a consumption of large amounts in a short space of time, also including dependency, and we need to look very carefully at people that are dependent on alcohol with short and long-term impacts. In 2019, there was a suspicion of the use of alcohol by the victim in moments of self-harm in 13.8% of the cases, according to Viva Sina. It is estimated that disorders due to the use of alcohol are associated to an increase of 86% in the chances of having suicidal ideation and 3.1 times in the chances of attempting suicide and even 2.6 times in the chances of completing suicide. So it is a multi-causal phenomenon. Suicide is it has many factors that will influence this, and alcohol is one of them. It is related, and this is very well established, to the alcoholic spectrum, fetal alcoholic spectrum disorder, which includes many damages caused by the prenatal exposure to alcohol, and it is the most common preventable cause of intellectual disabilities in the Western world, drawing our attention to the entire life cycle and the impact that the consumption of this product or of this psychoactive substance may have for different approaches, not only for adults, but for newborns, and the impact it can cause in future generations. The prevalence of the consumption of alcohol during gestation in global population is 9.8%. In Brazil, it is estimated that fetal alcohol disorder occurs in 14% of the children exposed to alcohol during pregnancy. It is also considered a factor of risk for communicable diseases. And here I'd like to thank the technical departments of SBSA that deal with STIs and infectious diseases, who also organized evidence on this field about the risks of alcohol, the higher vulnerability to TB, viral hepatitis, HIV, syphilis, and other STIs. It may interfere in prevention practices and may favor the practice of unprotected sex and the inconsistent use of preservatives, and it also negatively impacts in adhesion to the treatment of these diseases and in the response to the treatment. It is related not only to alcoholic liver disease, but also in the increase of the progression of liver diseases in other causes, not only within the scope of chronic and infectious diseases and disorders related to mental health, but also related to the worsening of these conditions. It is one of the external causes for death and injuries in traffic, which are the second cause of death of people between 1 and 49 globally. Well, not globally. Here we're mixing information from Brazil and global information, but it is the second cause of death in several age groups in the young population, especially between 5 and 9, 10 to 14, and other age groups. Driving under the influence of alcohol is a risk factor for 27% of all road accidents. In Brazil in 2017, the data from our last Viva Inquérito published, there was the consumption of alcohol in 13.1 of the cases where people were received in outpatient care, and we're going to have updated information on that very soon. In relation to interpersonal violence, in 2022, in Brazil, 29% of the notifications of interpersonal violence involved the previous use of alcohol by the assailant. And even though we cannot establish a direct causal relationship, the association between the use of alcohol and violent behavior is recognized in literature, especially against intimate partners, women, children, and the elderly. It causes costs to our health, to our security, and it causes the loss of productivity in our country. Current data calculated by researcher Eduardo Nilson and recently disseminated with the support of several NGOs and civil society organizations show that in 2019, the consumption of alcohol cost 18.8 billion for the country. And in terms of direct costs, we had 1.1 billion with hospital procedures and outpatient procedures and 70.7 billion of indirect federal costs. So it's very high cost for public agencies. In 2018, the public health system spent 1.7 billion reais with cancer treatments associated to the use of alcohol. And like Dr. Roberto Gil mentioned, INCA has been working with bringing evidence on this for many years and also bringing the economic impact that the consumption of this risk factor has for our population and for the government as a whole. So how can we surveil the consumption of alcohol in the country? We have three main sources of information. We have an annual survey. The last consolidated sample is from 2023 with 27,000 adults surveyed in Brazilian capitals, but I also have to mention that 2024 was just concluded and very soon the results will be published. The National Health Research, which is based on house calls and it's territorial in the country, and it is representative for the metropolitan region, for states, macro regions, and other sampling methodologies that allow us to go deeper into the population. And we have data from 2013, 2019, and 2025. We're going to repeat this research, and the National School Health Survey that is held every 3 years, investigating the risks for adolescents in a population between 13 and 17. And we will present data from the last publication from 2019 with 188,000 students researched in the public and private school system. And here I have an indicator which is consumption once a week or more. That is the weekly consumption of alcohol increased in all age groups, regardless of sex. We have data from 2013 and from 2019 showing this increase, and also in all race and color categories presented here, and in most groups in terms of schooling. The only group that didn't show an increase was the group of people who never went to school or who didn't complete school. But in all other categories related to schooling levels, we saw an increase in consumption, and we saw that the prevalence of this is constant in all groups, showing something that Dr. Gilmara said to us. We have the challenge of talking to all parts of the population, all age groups, all social groups, all race, color groups. So we're talking about a risk factor that is disseminated in the population. Here we're bringing Pigital data with another indicator, which is the episodic heavy consumption, which represents the consumption of 5 or more doses for males or 4 or more doses for females in the last 30 days in relation to the service. And in terms of the frequency of consumption, here I'm talking about a consumption that sends us an alert because it is acute consumption, the ingestion of a elevated level of alcohol in a single occasion. And if you look at that graph here, it shows us a slight increase among men, but a very significant increase of that heavy episodic consumption among women, calling our attention both for men and women. After 2021, we have an upward trend on this in the post-pandemic period. Among adolescents, and this is data from 2019, school-age adolescents, 63% have already tried alcoholic drinks at least once. Almost 35% took their first alcoholic drink at 13 or less. So children less than 13, 35% of them have already consumed alcohol, showing a very early onset of this risk factor, and almost 35%, even though there is a law that prohibits the sale of alcohol to minors, we say that almost 30% were able to buy alcohol in stores, markets, or bakeries. And we are also researching access to alcohol in current surveys because we also know of the role of delivery apps, and more recently in the digital environment, disseminating not only misinformation about the consumption of alcohol, which is not regulated for the publicity of this risk factor, and also in facilitating the sale of products and with no restrictions as to their purchase for minors. So this is something that we can talk about shortly, and it increases inequality. The use of alcohol impacts the population in a differentiated manner because it increases health inequalities, it increases the vulnerability of people who become disabled or become dependent or have disorders or acquire disorders. And we know that people with less access to healthcare have less of a chance of seeking treatment, support for situations of dependency, and also information that is able to prevent access to qualified information that is able to prevent the risks on consumption and the reduction of the productive force as a consequence of the use of alcohol.
Even though the use of alcohol is higher, people of socioeconomical levels, the hurtful impacts attributed to its consumption are higher in the least favorable socioeconomic layers. So I will start now to go to my conclusion because Chris reminded me that I don't have a lot of time. So I'll talk a little bit about these policies of facing or tackling these issues. As you know, we have clear goals in the 2030 agenda and in the SDGs, such as reinforcing the prevention and the abuse of these substances, including abusive use of substance and including alcohol. And we have a global action plan published by the WHO in 2024 for the reduction of this consumption, with a goal of 20% per capita consumption reduction until 2030. We calculated this indicator here in Brazil, and it is available. It's on the websites from the SDGs, and we observed that with the results that we have of the trend, we will not reach this goal. The goal would be to reach 8 grams of alcohol per capita, but we are at 9.8 according to the trend observed through the data. With our plan to tackle these diseases, these non-communicable diseases, for the period of 2021 to 2030, we have the goal of reducing the abusive consumption of alcoholic drinks by 10% until 2030 with an annual monitoring. And we saw as well that we will not be able to reach this goal with the data that we have collected so far. So it's urgent for us to adopt effective measures in the country to achieve these goals, and we are working on this selective tax as a very cost-effective way of reducing the consumption of these damaging substances, thinking, of course, on alcohol and reducing inequalities in the healthcare field, because we know that there is evidence in the world that the increase of the price of alcoholic drinks reduces its consumption, and it also reduces diseases and disorders associated to the consumption. So I won't go too much into detail here, but we worked a lot on the technical consulting for the Ministry of Finance, for the incorporation of this selective tax. We are right now starting to discuss the ordinary law, and our mission here is to provide the technical support in the bill of law that will define the aliquotas about these products, including alcoholic drinks. And here we are considering alcoholic drinks. And the second moment in this technical note is also very important. So, Chris, I think I need 5 more minutes to finish. But what's important is the establishment of what we call standard drink of alcohol. I started talking about this in the beginning of my presentation, and I just want to make a clear outline about what we are calling standard drink. The definition of what a standard drink is, or what is considered a quantity that is standardized of alcoholic drinks. This is what we're calling the standard drink. It's not supposed to be a standard, it's just a quantification of alcoholic drinks. It has this name, standard drink, around the world. And in the first version of this note, we called it standard drink, or standard dose in Portuguese. And it's already a way of us to make this nomenclature something that is palatable for professionals, educators, opinion formers, and the population about what this standard drink quantity is. What is it? It's a measure, a unit of measure for national use. It's a way that wants to establish a defined quantity of pure alcohol so that we can count the units relative to the consumption of alcohol, independent of the type of drink, the size of the bottle, or how much alcohol there is involved, because this is always different. So we have to standardize the unit of measure, this unit that we call a drink of alcohol. And without establishing this quantity, this measure, it's difficult to analyze and identify how much alcohol was consumed, because there's a lot of diversity in types of alcohol and sizes of bottles. So after a lot of technical discussions based on the best evidence available, we established the standard drink of alcohol in Brazil as 10 grams of pure alcohol. It's the same definition adopted and recommended by the WHO, and it's also used in 26 countries, such as Australia, Ireland, Portugal, and New Zealand. And it serves to improve epidemiological surveillance of alcohol consumption. It standardizes the indicators utilized, and it allows to compare different national and international studies. It also serves to communicate risks associated to the levels of consumption, allowing for the elaboration of recommendations that are more precise. And then we will avoid vague nomenclatures or terms that are used to confuse the population, such as excessive consumption, moderate consumption, and even responsible consumption. They pass the impression that we are not able to quantify this. And with this pre-established quantity, we will then be able to measure these categories in a more appropriate manner, in a more objective manner. So how do we calculate this? And this is all within the note. We have a formula. It's the quantity of pure alcohol in 1 milliliter of alcoholic drinks. It depends on the alcohol quantity of the drink. This is the grams of pure alcohol, which is the volume of the drink in milliliters times the percentage of how much alcohol there is in it over 100. So this is so that everyone can use this standard. And within the technical note, we have some examples. What is a drink? How much does it correspond to, depending on how much alcohol there is within the drink? So, for example, there is a long neck bottle that has a certain alcohol content with a certain quantity. It has this as a standard, and it will correspond to, for example, 1.5 drinks. And if I vary the volume or the alcohol content, I can also establish the quantity. We already have the relation shown by the formula, which shows how much every alcoholic drink represents in a different manner, independently of its alcohol content. We have some examples here of how to calculate this standard drink. And with that, we can also include it in a labeling proposal. For example, we have an example from New Zealand, Australia here, with materials that illustrate how we can inform to the consumer. We can do this by the label or in information that is communicated to the population about how much the drinks have in regards to alcohol. And I'll also draw your attention to this icon, which is an image that is communicating that the consumption is not recommended for pregnant women. So we have various possibilities to work with this information in the benefit of the consumer, be it through labeling, through educational information, or through communication campaigns. From the moment, of course, where we have all of these standards established. Some unfoldings and perspectives, I'm already reaching my conclusion. No manufacturer or producer will have to change their formatting of the labels of the drinks that they produce. And the size of the bottles or packaging of the alcoholic products will not be changed. But what will be discussed from now on are measures that will adapt this information and bring this information to the population to show on the label how many drinks are included in this bottle. So we do have the alcohol content and the quantity of liquid, but the people do not know how much of alcohol they are actually consuming. And currently the legislation establishes that this is all that needs to be expressed on the label. It has to show the percentage of alcohol content, but this is not enough to communicate the content and the quantity of ethanol in each of the drinks available. So thank you very much for the opportunity to be here. We will have a moment of debate now. I would like to thank you all for the partnership and to say that I have a colleague that, or a sister that is a journalist that is also working on subjects that I work on in the ministry. And she sent me an article from the Folha de São Paulo that we will start to see some reactions. And it's very likely that the industry will take these measures to try to confuse the population. How long did we take to be able to establish and to make everyone understand that cigarettes cause cancer and that they're bad for your health? It took a long time. It took years. And so we started to communicate this message that there is no safe amount of drinks that you can have and that alcohol is damaging to you. It causes cancer and various other diseases. So we are starting to see some reactions, and some articles are popping up in the press to try to confuse the population and to discredit this technical information, saying things as, oh, this is not exactly the correct situation. The WHO is actually even reviewing this international recommendation. So this is one of the narratives. And another one that I received from my sister, for example, it says that the CEO from Heineken said in an interview that we are expanding the sale of alcohol-free drinks and that we want to substitute the consumption of water and, excuse me, not, yeah, water and juice. And they're saying that we want to substitute this by drinking non-alcohol beer for them to get used to the taste of beer, for this alcoholic drink to then be introduced into the population, and other strategies such as flavored alcohol drinks and packaging to attract the young public to these drinks. So we have to work a lot on communication and public policies so that we can together demystify and destigmatize, or excuse me, denaturalize the consumption of this drink as something that is even safe, because this was an information that was even communicated, because of course today we know that this is not the case. So we have to unfold effective measures in terms of communication and in case of information in regards to labeling, and also thinking about the protection of the environments. So children and adolescents, pregnant people, people that have serious diseases or diseases that can be aggravated by the consumption of alcohol, there is a clear recommendation that alcohol should not be consumed. So this is where I would like to conclude my presentation, Chris, and we can now go to the reflection and comment session. I want to thank all my colleagues from academia and civil society that accepted our invitation to be here in this moment where we are publishing the technical note. Thank you very much, Leticia, for your words and for your presentation of the technical note. I would like to reiterate that the technical note is available in its entirety on the website of the Ministry of Healthcare. It's the 263-2024 technical note. It was done together with the SVSA, SAPS, the Secretariat of Health and Environment, the Secretariat of Primary Healthcare, and the Secretariat of Specialized Healthcare. You can find this document in its entirety on the website of the ministry, and we put this as well in the chat of the event. You have the link. So now, to continue, we would like to invite the researcher from the Center of Attention for Mental Health Care and director of the WHO, Dr. Kevin Shield. He will make a presentation about standard alcohol dose, importance and regulatory developments in the international scenario. Dr. Kevin, You have 15 minutes for your presentation.
Thank you for inviting me today. So today I'm going to talk about the international situation with both alcohol measurement and alcohol policy and what the new developments are in terms of communicating the harms that originate because people consume alcohol. So just briefly, I wanted to stress the importance of what alcohol consumption is doing globally. So for the most recent year, we have data. There's about 2.6 million deaths due to alcohol. So those deaths are occurring unnecessarily. If people didn't consume alcohol, those deaths wouldn't have occurred. And that represents about 1 in 20 deaths. So a large number of deaths globally can be prevented due to alcohol. And then when you look globally around the world, and specifically in the Americas, you can see that Brazil in particular pops out as a country, especially in the Americas, that experiences a disproportionate amount of harm in South America and in North America. And so the issue here is that something may need to be done in Brazil to make sure that they're not inequitably being affected by alcohol, because right now in the Americas, they're being affected more than most countries. So why are they being affected? Firstly, it's partially due to their development status. Right now, Brazil is a developing country, and therefore, because it's not a high income country, it will experience more harm per standard drink consumed than high income countries. So for example, something like the United Kingdom or France, they would have more resources that they can spend on healthcare compared to Brazil. And that would lead to an inequitable impact per standard drink consumed in Brazil compared to those countries. In addition to this, Brazil consumes a lot of alcohol. It's also important to talk about where that alcohol comes from. A lot of industry representatives will want to stress the amount of alcohol coming from unrecorded sources. So this is illicitly produced alcohol or artisanally produced alcohol. So alcohol that's outside of the government's control. And when you look at Brazil, there is a certain amount of alcohol that is coming from unrecorded sources, but most of it is coming from recorded sources. So if you implement policies like taxation, it's going to have a very large positive effect in terms of health because it can reduce alcohol consumption in Brazil. And even if you do increase taxes on recorded beverages, so beverages that are within the government control, it's also important to mention that unrecorded doesn't go up by a proportionate amount. So if you increase taxes, you will decrease the total alcohol consumption in the population. So some may go to that unrecorded area, but what happens is the total alcohol consumption in the country goes down, which is beneficial to the health of people in Brazil and globally. So it's also important here just to briefly mention where these alcohol attributable deaths are coming from. A lot are coming from different sources. So you have things like tuberculosis, infectious diseases, but you also have injuries, road injuries, falls, suicides, but you also have non-communicable diseases here. So neoplasms, diabetes, alcohol use disorders, epilepsy. And it's important to mention here that although alcohol may have a beneficial effect at low doses on diabetes and ischemic heart disease, the overall impact of alcohol consumption on the population is overwhelmingly negative. So at the individual level and at the population level, alcohol has a detrimental impact on health when you consider all health conditions. And you can't direct alcohol only to your heart. It will also affect things like cancer. So even at low amounts of alcohol consumption, alcohol is going to cause cancer. So there's no level of alcohol consumption which is considered safe. So with that said, how do we reduce alcohol consumption? Well, the Pan American Health Organization and the WHO have a strategy called SAFER, which includes taxation, availability restrictions, marketing restrictions, drink driving programs, so preventing drink driving, as well as treatment of alcohol use disorders. But to raise awareness of the impact of these policies, you also have to raise awareness for the need of these policies. So how do we do that? Well, one of the good ways of doing this is to communicate the harms done per standard drink people consume. And so that gets us to, well, how do we define a standard drink? It's not going to be a standard pour. So when people pour their drinks, like pour a glass of wine, pour some spirits into a drink, it's going to vary between individuals. So heavier drinkers are going to pour more, men are going to pour more. It's not standard. So right now we would have a problem because a drink to me may not be a drink to somebody else. And therefore, there's a need to communicate what is a standard drink, because we know that what people pour into a glass isn't consistent. There's also a problem of what constitutes a standard drink. So knowledge of what constitutes a standard drink globally is quite low. So to increase this, what other countries have done, and this was previously shown, is Australia and New Zealand implemented labels on alcoholic beverages with the number of drinks that are contained in that bottle. And what's important here is to note that the majority of the population is actually in support of these labels. So where the majority of the population may be against things like taxation, they don't want things to be more expensive. When it comes to labeling, especially with just the number of standard drinks within an alcoholic container, the majority of the population is actually supportive of this. So politically, it's something a little bit more favorable than something like increasing taxation, which is not as favorable and harder to pass. So this is something that can be immediately implemented in terms of not much of a pushback from the population. In terms of a standard drink, it varies across alcoholic beverages, and that's why it's important to note. This is what we use to measure it in the STEP surveys. But you'll also note that it's important to label how many drinks are in a container, because you can note that the beverage strength, this is just for beer, and the size of the drinks may vary, right? So it's not just the pour that I was talking about earlier, it's also the beverage container. So the amount of alcohol contained in that beverage, the strength of it would differ between beverages, and then the size of the containers are going to differ as well. This is an example from Australia, and you can see this is also an example from Australia for wine and spirits. So labeling helps prevent this confusion. But knowing the number of standard drinks in a container is only part of knowledge dissemination in terms of informing drinkers and non-drinkers how that alcohol impacts their health. What's also needed, and this is an example for Canada, are guidelines on alcohol consumption. So this was the guidelines that I helped develop that shows that there is no level of safe alcohol consumption. Even at 1 or 2 drinks per week, you're going to have a risk of cancer. Then it increases as you drink more. And this is really important to communicate to the population, because they can see that there's this clear gradient between no alcohol consumption and then how the harms increase as they start to consume more. Here's another example. So these are 2 graphs. The top graph is the alcohol attributable cancer risk among men per drink consumed per week. So 21 drinks per week would be 3 drinks per day. And then on the bottom, you have women. What this is really important at showing is, 1, the more alcohol you consume, the higher your risk of cancer is. But 2, which is also very important, for women who consume 1, 2, or 3 drinks per day, their risk of an alcohol attributable cancer is 2 to 3 times more than that of men. So 1, it highlights this dose response relationship. The more you drink, the higher your risk of cancer. But two, and this is especially important for women, and you can see at the bottom graph, the majority of that graph is made up of blue, that's breast cancer. Women are at a much higher risk of cancer per standard drink consumed. And so this allows us to communicate their risk of cancer, and it's in an absolute term. So your risk of a cancer, an alcohol triple cancer, if you consume 21 drinks per day, 21 drinks per week, so 3 drinks per day for women, is about 6 in 100, so 6%. So that it climbs up quite quickly. We've also done a couple different innovative things with this data. So for the Canadian data, what we've also done is we've created an online tool, and if you go to this website, you can see it. You input your age, what you currently drink, and what would happen if you reduce your drinks to a certain amount. So this allows you to say, how many standard drinks do I currently consume? And what would happen if I decreased that consumption? In this case, I put 14 to 7, and that'll show the impact on health. But we also wanted to go further. There's also a lot of costs associated with that alcohol consumption. So just the costs of the alcohol itself, but also you have various other costs that are due to alcohol that can be highlighted. And lastly, we wanted to highlight calories. So this would be important for people who consume alcohol. They are usually not aware that alcohol contains a lot of calories. And so alcohol, if consumed in excess, can also be a factor leading to obesity. It's also important to look at how it's measured in surveys. So this is just a brief snapshot of the surveys on alcohol consumption in Brazil up to 2019. And you can see how these standard drinks are used and are vital. And this is why it's also important so your population knows what a standard drink is. It's vital in binge drinking, measuring binge drinking. It's also vital in measuring how much your population is consuming. And then how much they're drinking during pregnancy. So are you drinking during pregnancy? And then if so, how much are you drinking during pregnancy? Are you driving after drinking? And if so, how much did you drink before that? There's a very strong dose response relationship with the harms of drinking during pregnancy and the harms of drink driving. The more you drink, the more that's going to impact your risk of complications during pregnancy and damage to the fetus, as well as drinking driving. So overall, there is a need to define a standard drink. The WHO recommends 10 grams. That's the most frequent. This will also help prevent confusion, as is in Brazil, between other countries. So the more countries that use this 10 grams, it allows for more cross-country comparisons and less confusion. So when Canada, the United States, or other countries release guidelines on alcohol consumption, that news may reach other countries, and often it does. If they don't have the same standard drink, it can cause confusion on the impact of alcohol on health. So it's always important to make sure that countries are using a similar measure, and that's what we want to move towards at the WHO, which is a unified measure of a standard drink internationally to prevent confusion across countries. And with that, I'll end my presentation.
Obrigada, Kevin.
Thank you, Kevin.
Agora eu vou pedir.
And now I'm gonna
professor
ask
Eduardo Nilson,
Professor
que-
Eduardo Nilson.
Ah, não, desculpa.
Oh,
Furei a
sorry.
ordem aqui, furei a ordem. É a professora Raquel
Cut the line
Deboni,
here. Professor Raquel
e
Deboni
a professora Isis.
and Professor
Comecem
Isis
os
to
comentários. Preparamos momento de comentários e reflexões.
start
E,
our
gostaria de
moment for
convidá-los a
comments and
iniciarem
reflections, and I'd like to ask them
falas.
to make their interventions.
Bom, boa tarde a todos e todas.
Good afternoon,
Vocês estão
everybody.
vendo a minha apresentação?
Can you see my presentation?
Sim.
Então, cumprimentando
Well,
a doutora Letícia Cardoso.
I'd like
eu quero
to
estender meus
greet
cumprimentos
Dr.
às
Letícia
autoridades
Cardoso
que estiveram
and to
presentes
all
nessa
authorities
abertura, e
who are
aos
present in the opening
colegas.
session, and to
É
all
uma
of
grande honra
colleagues. It is a huge honor to participate in this event, and I would really like to thank you for inviting me. So first and foremost, I'd like to congratulate the Ministry of Health for this technical note, this very brave technical note setting a standard drink in our country. That's a huge advance, and it is a fundamental step so that we can set a common language that allows us to tackle the consequences of alcohol consumption that Dr. Leticia and Dr. Kevin talked about. And I have this picture here to remind you about the Tower of Babel myth, and to say that in order for us to meet large goals, we need to have a common language. And the standard drink is a small brick in this building that all of us will be able to use for a series of advances that lie in our future. When we talk about alcohol, I think everyone mentioned this, but I'll highlight the importance of considering alcohol as a commercial determinant of health. It's one of the four. We have tobacco, alcohol, processed food, and fossil fuels. And when we talk about this type of product, we're also talking about a very lucrative market. So it's not easy for public health to bring this message of health when there are so many other messages with the goal of selling alcoholic drinks. And this is very polemic and causes the dissemination of confusing information to the public and to health professionals. And we often are not able to fully train these professionals because it's hard to talk about this. So it's important for us to have this common language for all publics, but it's not easy. And Leticia also showed that alcohol reaches all parts of the population, all age groups, and impacts all sexes. So it's not easy to create this type of message. And in science, alcohol research is a vast field of knowledge. We have research in medicine, biochemistry, biology, human sciences, law. All of these areas have their own specificities. There are many definitions, methods. So the standard drink is also important for us in the field of science to be able to communicate. So this definition, the systematized and reproducible definition, will be fundamental for us to move forward in three main areas that have as a common goal the health of the citizen. These areas are science, public policy, and information and communication in health. When we're talking about science, we will be able to standardize our questions and surveys for the collection of clinical and epidemiological data. And with that, we increase the precision and the reproducibility and how comparable our studies are, both nationally and internationally. And we're also able to facilitate the harmonization between databases and databases that we already have access to. Currently, with Open Science, we're very interested in comparing our data to the data of other researchers, so we'll be able to harmonize by using a measure that is recommended by the Ministry of Health, because sometimes one researcher wants to do things one way and another wants to do things another way. So having a standard fast tracks our decisions and facilitates multidisciplinary integration, bringing collaboration between different areas of knowledge in the same way as there was this intersectoral collaboration in the Ministry of Health for the issuing of the note. And this is an important message that we are repeating, but I would like to emphasize, which is the importance of collaboration between different departments. And for science, this is a huge advance. When it comes to public policy, the standard dose or standard drink is fundamental for us to monitor and implement policies. And we had this huge advance in the tax policy, and now we will need to monitor the implementation and monitoring. It will be important for us to have clear measures. Kevin and Letitia also talked about the labeling of alcoholic beverages, the publicity, its availability, and all of the policies that will be commented when we talk about the SAFER initiative. And lastly, in terms of information and communication in health, what I would like to see as a next step, briefly, the possibility of us being able to establish recommendations, guidelines, and clear national guidelines about the consumption of alcohol in health. We have a consensus in the health field that there is no safe consumption of alcohol. All consumption is risky, and the more consumption, the higher the risk. But when someone goes to a doctor's office, they're going to say, Doctor, I'm not going to stop drinking. What is a dose or a drink standard that will not bring me as many problems? We also need to be able to communicate what is low, what is moderate risk, and what each additional dose that I'm drinking or each additional drink means to my health. And this definition is very important for us to move forward in the establishing of these recommendations about alcohol consumption in health. Some countries, Dr. Kevin has already shown, and I'll bring the Canadian example, but first I bring Australia, already have guidelines to reduce alcohol consumption and the damage associated to alcohol. And this is in the Australian government's website. And the message is very clear. If you're a healthy adult, and this is valid for people who are adults and don't have any diseases, to reduce the risk of damages, men and women should not drink over 10 drinks a week and no more than 4 drinks a day. This is one recommendation, and we need to evaluate what would be useful and pertinent for Brazil. And there's also in the recommendation, what is a standard drink? 10 grams in Australia, and there is also some guidelines related to that. And here, Dr. Kevin also mentioned the Canadian guideline. I think it's an example. They updated the 2011 guideline. They spent 2 years revising it to reach these recommendations. And I really like this format that shows clearly what is low risk, no drinks, low risk, moderate risk, and an increasingly higher risk. And this type of message is fundamental for us to reach the population and the health professionals with a clear message saying, look, this is the health department's opinion. And in the health department, this is what we think. And to conclude, the setting of a standard drink will promote a standardized understanding on consumption. It simplifies public health messages, which is not easy. Talking about alcohol, it strengthens trust on the information imparted, and that is very important in the era of misinformation we're currently experiencing, and it aids citizens in making informed decisions about consumption and health. And that is the fundamental point. We don't want to define how much every person is going to drink. People need to be able to make their own decisions about their own health. But in order to do that, they need to have information that is understandable and simple and consistent between different health professionals. So with that, I'd like to thank you, and I'm at your disposal for our debate. Thank you.
Obrigada, Raquel. Eu nem te apresentei
Thank you, Raquel. I
adequadamente.
didn't even introduce you properly. Professor Raquel Deboni is a deputy professor in the Department of Medicine, Family. Oh, no. My bios are switched here. She's a researcher in the Institute of Scientific and Technological Health Information at Fiocruz, and she has been a huge partner in our
confecção dessa nota, mas não só.
drafting of this note, but not only that, in other work fronts as well here in the department that I'm currently leading, the SVSA in the Ministry of Health. Thank you, Raquel, for such a clear presentation. I now pass the floor to Professor Isis Eloá Machado. She is a deputy professor in the Department of Mental, Family, and Collective Health in the Federal University of Ouro Preto. Isis, you have the floor. Thank you, Letícia, for introducing me. Good afternoon, everybody. And in the name of Dr. Letícia, I'd like to acknowledge my fellow panelists and authorities present here in this event. And I'd like to start by congratulating DAENCHE for its leadership in drafting the new technical note and for coordinating different departments in the Ministry of Health and also other teaching and research institutions nationally and internationally. We have the presence of Professor Kevin here and also a representative from PAHO. And I'd like to highlight that the technical note is an important step in the implementation of the scientific research agenda about alcohol, considering that this is one of the roles of health surveillance in the public health system, listing the demands for scientific research, and also the role or the duty of research institutions of collaborating with the good functioning of the public health system and contributing to its improvement. So that in and of itself is an important impact of this technical note. So perhaps I'm repeating some things here, but I am highlighting how important the standard drink is, considering that the volume of alcohol consumed is related to an increased risk for several health outcomes, as was mentioned here, especially chronic diseases, and also for external causes like violence and traffic accidents, and also the role of excessive consumption, which increases the risk of several other maladies. And in order for us to study the impacts of alcohol consumption in the health department, we need to evaluate or ascertain the number of alcohol that is consumed. We can do that by studying the consumption of alcohol throughout one's life, drawing a relationship with alcohol dependence, and looking at the numbers frequently consumed, and also asking about the frequency of excessive use. And all of these three forms of ascertaining can be used in populational surveys. And we also have, we can use etylometers and measure alcoholemia, which gives us an exact number of alcohol in someone's organism, very much related to the external causes events. And it's another measure that can be used in scientific research is the alcohol consumption per capita based on the production, importing, and exporting of alcoholic beverages based on data related to sales or taxation. But we still have a hard time in ascertaining this volume, even though we have many methods. Letícia also mentioned the diversity of types of alcoholic beverages, and within the same class of alcoholic beverages, each one has different alcohol volumes, and also there is a diversity of sizes in standard measurings like glasses or cans. or bottles and in the way that they are sold. And this makes it hard for the participant in the survey to clearly inform the amount of alcohol consumed. And in having a standard drink number, we start looking at this problem, which is ascertaining the amount of alcohol consumed, and we can have an improvement in the results obtained through the surveys. In addition to having good indicators, we can also produce evidence summaries because we need standardized results for the research in order to combine several studies and do a summary of evidence. As we can see here in this graph, the summary of evidence of the relationship between strokes and the consumption of alcohol. So the importance of setting a standard drink, the induction of is important for the encouragement of research about the consumption of alcohol and its consequences in the Brazilian population. It will also lead us to increase the precision in data collection in studies and have more reliable indicators. And this will also allow health professionals, when filling out government registries, to report in a more standardized manner and allows us to use that information in a more scientific manner, because that data can also be used for research beyond data surveillance. And this will also cause us to have more reliable indicators about the amount and volumes of alcohol consumed by the population, and it will allow us to communicate the results of scientific studies in a way that's clearer. We have so far different indicators that are used in this research because they ascertain consumption in different ways. So the National Health Survey does things one way, other surveys does things differently, and this causes our indicators to not be talking exactly about the same amount of alcohol, and it will also allow us to have, in addition to comparability between our studies, to compare with other national and international studies, reminding everyone that 26 countries use the same definition that we're setting right now, 10 grams of pure alcohol. And this number of 10 grams also makes calculations easier because dividing by 10 is easier. Other countries use 14 grams, which makes it harder to do calculations. And lastly, how easier it becomes to do evidence summaries and use these summaries in the production of guidelines about alcohol consumption, like Raquel just said. Well, thank you, Leticia, for inviting me to participate in this technical note and also for allowing me to be here with you today. Thank you, Isis, for your presentation, very enlightening, and for your partnership as well. On behalf of the two researchers that just presented, we also thank the entire technical group of experts that supported us here in the Ministry of Health in leading this effort. I would also like to invite João Ricardo, a technical consultant from PAHO, WHO in Brazil, to make his intervention about the SAFER package. The previous presentations, Dr. Kevin, Raquel, Isis mentioned the SAFER package, but we will now hear a more detailed presentation about this initiative. Just a second, let me just share my screen. But if I'm not able to do that, we can do that without my presentation because some of the points I'm going to mention were already presented. So let me give my presentation without sharing my screen because I'm having some internal technical problems here between me and the computer, basically. Well, I'd like to start by presenting or introducing some of the discussion or the context in which we had this discussion about the SAFER package. First, we should identify that PAHO already works within its technical cooperation strategy. It has within non-communicable diseases and mental health actions related to mental health, the use of psychoactive substances, and alcohol. So within this framework of the discussion about non-communicable diseases and mental health, we insert this entire discussion about alcohol and also tobacco and the use of other addictive products. How was this evolutive process of the tackling strategies? Just to give an overview about this history, the World Health Organization itself went through a process of gathering information about the topic. So the first time we had a Pan-American conference, for example, was in 2005. That's when we had the first Pan-American conference about alcohol, and a guide was elaborated about alcohol and its epidemiological issue. In 2008, we had a discussion about alcohol and primary healthcare. In 2010, we had the first global strategy for the tackling of alcohol dependence. And in 2011, we reached a higher level because we had the first high-level meeting in the UN about the topic. And then we evolved, and in 2016, 2017, we had the first discussion about alcohol and marketing, which is a very sensitive topic. And starting in 2017, we have an entire discussion within the WHO about how to build elements to create cost-effective measures in the implementation and in the reduction of the prevalence of alcohol consumption. And within that model, they created SAFER. And I will also bring you a comparison because in the same way that we have this modality of cost-effective policies, they also exist for tobacco. Tobacco has the Empower, which is a package of measures focused on reducing through cost-effective policies. So SAFER is a strategy that is close to what was used for the tobacco agenda, but with specific characteristics. So how do we build this SAFER logic? First, we have S, which would be restricting availability. So we would be reducing the offer. How do you reduce availability? So the first vision was reducing the commercial or public availability of alcohol through laws, policies, programs. So the prohibition of consumption for minors, prohibition of sale, and setting of specific places for sale. For example, in some countries, you have the prohibition of alcohol consumption in public spaces. So you have an entire set of restrictions that will lead us to avoid consumption. The second SAFER measure, which is the A measure, are measures against drinking and driving, because alcohol consumption and driving causes a series of accidents in traffic is very impactful. So the way that we would combat this would be a restriction, setting specific restrictions to drinking and driving, having control posts, doing random controls, like, for example, in many states, we have the law against drinking and driving, alcohol tests and also showing the impact of diseases and people on wheelchairs to be very flashy about this impact. And the third, which would be F, aims to facilitate access to triage and treatment. It would basically be a line where we would try and reduce or interrupt alcohol consumption so as to decrease health risks through efficient interventions whenever necessary, especially to help families, etc. So in that case, there are two modalities which are interesting. One is the brief intervention, which has something that would be very interesting for us to develop and improved in Brazil. And if you don't know about it, it's a group of rapid questions that are asked when you are providing health care, if you're a dentist or a health professional, and when you see and then you forward someone to treatment. So basic information has a very significant impact. So the brief intervention is very important, and also the importance of cessation. E would be one of the most complex elements to deal with, which is the tackling of advertisement and publicity. This is a very hard agenda, especially because of social networks. In the tobacco agenda, we had a very strong evolution because we didn't have as much media. You had TV and the prohibition of TV advertisements or any type of overt advertising. But currently, you have a more complex situation because we are now also talking about the civil framework of the internet. So it's a very complex discussion, and as was said, it often targets children and adolescents, and like Dr. Leticia well said, alcohol experimentation starts at 13, 14, so we can already identify excessive consumption of alcohol as a pediatric diseases. And lastly, the R would be the increase in prices and taxes. So specific taxes on alcohol and pricing policies that are one of the control measures that are most efficient to reduce the excessive consumption of alcohol, and also creates a positive counterpart because it gives the government revenue to cover the costs incurring from the consumption of alcohol. So along general lines, this is the package. The measures of the SAFER initiative would have the goal of saving 100,000 lives up until 2030. So it is a project that has indicators and a target, and it should offer a return of over $9 billion, $9 for each dollar invested. It creates positive results, especially when it comes to the loss of life. It seeks to protect billions of people from the socioeconomic impacts of alcohol, and it will contribute to the SDGs. In this context, I will only emphasize one thing, because we often see the SAFER agenda as more related to the health field, but there's also a very interesting association between the reduction of the vicious circle of poverty and alcohol consumption. So if you, for example, avoid or reduce alcohol consumption in a family, you increase collective income. And for example, the issue mainly associated to forms of violence against children, domestic violence, violence against women, and the negative impact of alcohol in education, in schooling, so we can improve school results when we avoid the initiation of that youth.
And without a doubt, there are various other points that we can relate to this, and there are various interesting studies that talk about the trade-off between water and alcoholic drink. Because if you're using water, for example, to produce beer, you could be, instead of creating beer, you could create food, healthy food. So in this sense, you have this whole discussion around the impacts of the loss of opportunity that you have due to the consumption of the elements related to the production of alcohol. And it's also very important to highlight because this is directly related to this entire discussion about sustainable development. All right? I believe that in general terms, these are the main points that I wanted to touch on, because I wanted to give us more space as well to have a more broader discussion. So I'll conclude here, and if you have any questions, I'm at your disposal. Thank you very much, João, for bringing us the general terms of these initiatives and the complexity of each of its letters in the acronym for us to implement them into policies and actions. For some of them, we have a more short to medium term perspective, and other ones are more long term. But it's very important that you brought us the perspective of this initiative that guides us as a government and as actors here, so that we can think of what is most cost effective and what we can invest in. So now I would like to invite Luciana Sardinha. Luciana, thank you very much for having accepted our invitation. She is the Deputy Director for the DCNT initiative in Brazil from Vital Strategies. So Vital Strategies has a long trajectory in advocacy and in the promotion of communication campaigns aiming the prevention of alcohol use. So it's very valuable to have Vital Strategies present here, and Luciana is here representing this institution that is so important on this topic. Luciana, you have the floor. I didn't tell the other ones, but you have 7 minutes. They were keeping within their time. So the floor is yours. Thank you very much, Leticia, for the invitation, and congratulations to Daenche for this important initiative at this moment where we are discussing alcohol and its importance to Brazil. So we work at Vital. It is an organization that globally works with public healthcare policies for more than 20 years, and we have Reset amongst our projects here in Brazil that works with data and evidence and strategic communication to support effective alcohol prevention initiatives in the country, including among them Brazil. And this work came after a lot of experience on this topic. Vital worked together with the WHO and the team that developed the SAFER package, which João just explained to us. This initiative that reduces the damage to healthcare and the economic and social impacts that happen due to alcohol. And the establishment of this standard drink is an essential contribution to the strengthening of surveillance and the monitoring of public policies for the reduction of the consumption of alcohol. For example, currently, the measure units that is used for a can of alcohol or any type of alcoholic drink can favor the excess use or consumption. And if on one side these show are a very difficult tool, these indicators can also be underestimated, and the standard drink can be a very important contribution as well for this improvement. This definition is also very important to standardize the understanding amongst the different actors that work on this agenda by making the way of monitoring and meet the goals agreed upon standard. And to have this may help to make the population understand how much alcohol is really being consumed. This is why the WHO recommends 10 grams of pure alcohol to be the standard drink. This was also adopted now by Brazil. According to the WHO, 54 countries already adopted this definition of standard drink, among them 26 countries that already use the same one that is used here, which is 10 grams. Another very important definition brought with the technical note is the approach of the use of alcohol as a public health care problem due to the impact of its use, and the recommendation that there is no safe use of alcohol, especially for those that are pregnant or children or people that have health issues. After the definition of standard drink and the presentation of guidelines for safe consumption, as other countries have done, such as the UK, New Zealand, and many others that people have mentioned here already, they started to include the labeling of alcoholic drinks, including how many standard drinks there are. And this has been very positive for raising awareness in the population of the quantity of alcohol ingested. This debate can also be expanded for the definition of alcoholic beverages in Brazilian legislation in regards to advertising, which excludes currently, for example, the beer industry. The promotion of spaces such as this webinar, which is very important for the discussion of the next steps for the effective implementation and information to the population about the standard drink in Brazil, is very relevant. The Vital Brazil, and especially Reset, is at your disposal to continue presenting evidence and participating in debates to disseminating tools that are so important for Brazil to be able to reach its goals in public health care. Thank you very much for this opportunity, and we will continue being here at your disposal for collaboration.
Oi, pessoal, eu caí e voltei.
Hello, everyone. I disconnected, but I'm back.
Você finalizou, Lu?
Did you finish, Lu?
Desculpa.
Yes, I did. I thanked everyone. Apologies, I disconnected, but I'm back now. So thank you very much for your participation and for the partnership of Vital and the various initiatives that we're working on together. We have a technical cooperation agreement with Vital Strategies and with various lines of action, and we hope to count on you in the unfoldings, especially in regards to the communication part. And soon we will have this rapprochement so that we can work more together about this. Now I would like to invite Professor Eduardo Nilson from the Fiocruz Brasilia Foundation to make his presentation about the cost of alcohol and the impacts on the society and the economy in Brazil. Thank you very much, Leticia. And I'll start by congratulating everyone from the Ministry of the Health for this technical note, which is a great advancement for the policy, but also thinking about the studies and the research itself. And I'll talk about some of the results that we had in some researches that benefit a lot from this. So I want to see, can you see my presentation? Yes, we can see it. All right, thank you very much. So let's start talking about this. I'll just quickly reinforce that which was already mentioned here, that the epidemiological burden is very large in regards to the alcohol consumption. And this is reflected in all the countries, of course, but I'll talk about the national studies. And this is very important because, of course, there is data such as the one here where we see the global burden. But we have also very specific national data, such as this study that was done together with Vital Strategies, and we were able to advance more. And this shows the multiplicity of these things that are attributed to alcohol, including deaths and the few benefits that exist for diabetes or cardiovascular diseases. It is not compared to the evils or the damage that is done. And there's also a very high economic burden as well. And this is one of the main components that we wanted to measure here in Brazil with this data. But here we see that the cost has a lot of sources. We have the direct out-of-pocket cost, and we have indirect costs as well, which is unemployment, absenteeism, which is the loss of productivity, even though they are at the, people might be at the job due to the use of alcohol, they can have less productivity, the household or leisure time, premature mortality, which is huge as well, as you will see, early retirement as well, and other costs. So various methodologies and various studies and various sources. So everything will be very determined and in regards to what is available so that we can compare this data. But we see very clearly that premature mortality is very important. And now talking specifically about a study, thank you very much for mentioning this, Luciana. I'll try to give more detail about this, just not too much. So if you want to read about this, the report is available in the Vital Strategy website. You can download it on Google. There was a lot of repercussion in the media in regards to these results in terms of the cost, which is very high, and the direct and indirect costs, which reach 18.8 billion Brazilian reals, but also the mortality attributed to this, because this is very important. It's very important to work with the epidemiological and the economic burden at the same time. And so very quickly talking about what was different in these one, for example, that Kevin showed us as well, about this methodology. We have various methodologies depending on the different data and the different input in our models. We use this and the sources. So what we did in this study, we had various different approaches, but one of the main ones was to adjust the prevalence of alcohol consumption in function of the per capita consumption with a basis on the market, because we know that there might be an underestimation in regards to, for example, the self-declaration of the use of alcohol. So we made a little adjustment in regards to this, but we also distributed it to the different ages and sexes of the people. We worked with different age groups, and working as well with a relatively meta-analysis risks. So something that was talked about a lot was that there is, the higher the dose or the drink, the higher the risk. There is no safe consumption. So even if you drink only one standard drink, it will have repercussions. But such as we saw, there is a graduality, and it's very important to show this to the population as well in terms of reducing damage. And of course, we have a lot of data that we have from the Unified Healthcare System and various other institutions, and we have many components of costs, of direct and indirect costs. The direct ones are the ones with the healthcare treatments, and the indirect ones would be the other economic losses. We also have intangible losses such as suffering and other things that are not measurable at all. We cannot measure them at all, but they cause impacts. And here I just highlighted in bold those components that we were able to measure the completely or partially in our study. So here we have in terms of the international disease codes, we have infectious diseases, we have chronic non-communicable diseases, violence and diseases, and other diseases that can be attributed to the consumption of alcohol. So this is very important to work on. And here we can see it in a table that we have, we can see that the higher the consumption, the higher the relative risk. So we can go from 0 grams a day to 72 grams a day. But I think that even taking a look at this, we can associate and adjust it in regards to the standard drink that we have that is going to help us be more aligned. So based on all of this, there is no safe level of consumption. And as soon as you increase the standard drink, you increase the risk. And here we can see that the highest consumption is amongst men, and we can see that the situation is very serious because the consumption is starting to be done at a younger age. And we also have complementary evidence such as the increase of consumption between women and other young people. So we have to talk about this as well. Here we had almost 104,000 deaths attributed to this in our study. So this is a very serious number. And in fact, it's very important. And here, of course, cancer, it impacts a lot. And even though it has some benefits for cardiovascular diseases, And here we have also liver diseases that are very impacted. And of course, accidents and violence is also very impacted, highlighting, of course, between men. And there's also a great cost among women as victims of domestic violence, femicide, and other issues. And here is a brief summary of the direct costs that we have. We only measure the federal costs from the unified healthcare system, which add up to 903 million Brazilian reals in hospitalization and outpatient procedures. Of course, there's also the high impact of cardiovascular and digestive diseases, which is expressed in the mortality. The interpretation apologizes, but the speaker is speaking too fast. And we were talking especially about cancer amongst women. It's much more prevalent in women. And the outpatient cost is much higher for women than men, for men than women. So there's a high determination in regards to cancer. And the high costs, as I talked about, in regards to the accidents and violence, and this lack or the various diseases that are associated to alcohol use, including mental health disorders, are not diagnosed a lot in our healthcare system. So this is also something that is not included in the cost research. And the indirect cost is even higher, mirroring that what scientific and traditional literature is showing us. So 17 billion Brazilian reals per year are associated to premature mortality. And so taking out these individuals from the life takes away all the productivity. And this productivity is lost. At the same time, there are other costs, such as the cost of social security, which of course is much higher amongst men. And we see some things like premature retirement associated to cancer, which is very high amongst women. And there is a lot of impact in absenteeism. This is due to hospitalizations and other issues that can result in absenteeism. And this sums up to 644 million Brazilian reals per year. So summarizing all the data that we have, there is 18.8 billion Brazilian reals in direct and indirect costs. All the details are in the report. As I said, we have some details here, and even though this data is alarming, we see that ultra-processed food, smoking, and alcohol use are public healthcare issues that have to be dealt with together with the industry as well. And for various issues, these are underestimated. Some of these issues are that some diseases are not included. So some of this data from some diseases associated to alcohol are not included in this research. They only consider the federal expenditures of the unified healthcare system. And it was very nice to hear from Gilmara the data from the primary care secretariat that now we can also include in our report, so that we can show this extra cost. And it does not, or excuse me, it includes the federal, it does not include the cost from the states and the municipalities. In regards to the indirect costs, we have various components that cannot be measured. Other forms of absenteeism with a medical note. And there are some studies that show the cost of the hangover in the next few days. And all of this is associated to an excessive consumption. Economic losses of informal workers is included as well. So various components that we have from other sectors, for example, the private drivers and chauffeurs and the app drivers and deliverers, many times these ones are not counted because they don't work or they work informally, so they are not included. So this is something that we want to improve to show this impact in the future in a more precise manner. In my last slide, I would just like to reinforce the necessary measures that we need. Of course, all of this is, we need information to the population and to the legislators, because we need support to implement these public policies. It's very important for Brazilians to support all the taxation or the taxes and the higher costs on alcohol, tobacco, and ultra-processed food as well. When we talk about the fact that there is no safe doses, sometimes we only think about the consumption of alcohol in regards to excessive consumption. And we also have socially acceptable consumption, which also has health repercussions. And populational monitoring is also very important. And this could benefit more research and new models in the future. Of course, we also talked about taxes, publicity, labeling, which was also a component that is very important for communication with the population. And finally, highlight that this study is not ended now, it's continuous. It's being done together with Vital Strategies and other partners to evaluate the public policies. It brings alcohol as one of the components of selective tax. But we also have to talk about the aliquota and what impact that will have. We need one that is more effective in regards to the consumption reduction. We talked a lot about education level, race, and other components that are also important to be included so that we can approach equity in these policies. And, of course, making models for estimations in the future so that we can support the other policies as well. So now I would like to conclude, and I'm at your disposal to answer any questions that arise. Thank you very much. Thank you very much, Eduardo, for your presentation. Very interesting data, and we know that even with limitations, we are already able to approach a big part of the problem. The team has some comments here from some participants. We have participants from all over Brazil, from non-communicable chronic disease surveillance departments, health promotion departments, and people that work in road security, in the road security field. So this is because of these accidents and that can happen on the roadways. And they use the same nomenclature. This international disease code is used by us as well, and there was a lot of debate about this issue, and we also consider these to be avoidable. These are situations that can be avoided. The great majority of them can, if not by 100%. And the nomenclature that will be adopted by the International Classification of Diseases 11 are events related to transportation accidents. So we will leave the field of accidents and we will adapt to this more modern nomenclature. So this is an answer already. There was one comment from a person. They asked a question about SAFER. So I would like to ask João to help me with the answer. by asking, is it already implemented? If so, in what countries is it already implemented? And João and Kevin, if you would like to add to each other's answers, if it's already implemented in Brazil as well, and in what countries is it implemented? So from us, from the Ministry of Health, we can say that we were inspired by this initiative to advance on the policies for regulating alcohol use. So it's not completely implemented in my perspective because there is a set of good practices that we still have not been able to advance upon. But we would like to hear from Kevin in a more global perspective, what countries have this more advanced initiative. And we would like to ask João if he could make some comments about SAFER in Brazil and how he perceives the implementation or the implementation potential. Would you like to start with Kevin for him to give his basic overview? Yes, Kevin.
Yeah, so SAFER has been implemented to a degree in numerous countries. I'll start with taxation because this is the easiest to go by. Taxation varies between countries in terms of pricing. We don't have great data internationally on how much alcohol costs in every country, but there was a recent study done in Europe where they've shown that there's a huge variation in the pricing of alcohol and taxes put on alcohol. And in this case, Finland had the highest. And so what I think is needed here in the Americas would be an understanding of the price of alcohol in various South American countries. So you can point to Colombia, you can point to Peru, you can point to different countries. And you can say that if we increase the price of alcohol in Brazil to the highest among our neighbors, what would happen to the alcohol attributable harms? And typically they go down substantially. Taxation is the most effective way of reducing alcohol attributable harms. Otherwise, there are not good bans on marketing. Marketing is very prevalent, and it's extremely hard to regulate marketing right now, especially with an online environment. So many youth are exposed to a lot of alcohol advertising through online advertisement, and a lot of work needs to be done there in terms of marketing restrictions. Availability, a lot of work can be done there, especially within densities. Typically, this is work not just done at the national level, but at the local level as well. So this would be more of the WHO, UN's Healthy Cities initiative. So there's a need to work with cities to make sure that the number of establishments, so this is on premise, so where you can drink at bars and things like that, and take away alcohol, that the number of those outlets are limited. We don't have good data on that internationally because that's usually done at the local level. But again, that would require in Brazil a lot of work with local governments, not just at the national level, but going in and working with cities. Drink driving, it varies across the world as well. The best standard here would be the lower the BAC acceptable while driving, the better. So some countries have a higher BAC while driving, and some countries have a lower. So the lower that acceptable BAC is, the more accidents you're going to produce. But there's also a need to enforce drink and driving. So that would include, and this is a new experimental study design, but it's being done currently in a couple countries, where every time a police officer stops somebody, they measure their blood alcohol content. And it's hypothesized that this may be an extremely effective measure of getting drink drivers off the road. So if somebody's speeding or their license plate, in Canada, we have stickers that validate them to a certain time. So sometimes for innocuous things that you wouldn't expect a person to be drinking and driving, when you stop them, you can actually, because you're doing a BAC test, blood alcohol content test on everyone, you can detect that. So that's a good one as well. And then for treatment, typically less than 10% of people with an alcohol use disorder are treated for that alcohol use disorder. So the treatment, even with screening and brief interventions or something more intense, so like a psychologist or psychiatrist treating that alcohol use disorder, there's a lot of work to be done there. Even in most high-income countries, most primary care physicians, so that's the doctor you would go see, we call it a family doctor in Canada and the United States. Typically, they don't even screen for alcohol use disorders. And so a lot of work is needed to be done there in terms of working with family physicians and organizations of family physicians to make sure that they're aware that they need to screen for alcohol use disorders and how much of an impact just screening for alcohol use disorders and providing brief interventions can help reduce alcohol consumption. So that covers the SAFER. I think globally, there's a lot of work to be done in every single country, and hopefully I've outlined some good ways to proceed forward.
Thank you, Kevin. João?
Sim. Vou trazer algumas
Well, I'm
informações.
going to bring some pieces of information in order for us to have to reflect a little bit here. Just to give you an idea, the 2018 data, which was the last big report about alcohol, says that 95% of the countries in the world tax alcohol consumption, but less than half of that uses any other type of strategy. For example, we have, for example, now in Brazil, we're establishing the an added value to the tax. But for example, we still don't have the prohibition of sale below the cost or strategies of prohibiting discount per volume. We don't have a minimum prices legislation. So this point is a point where Brazil, for example, is evolving by setting the tax, but there is still potential space to set other tax measures. Most countries also have some type of restriction for example, beer advertisement for TV, radio, papers, but this is still very incipient when it comes to internet and social networks. In Brazil, we have a discussion about the time of the advertising, and there is also a very interesting way forward when it comes to, and here, for example, the CETAB team is really involved in this discussion about the amount of images of people drinking some kind of alcohol in movies, streaming, without any type of notification. And Bollywood really evolved on this topic because they were able to show a message of prohibition, saying that it is forbidden to smoke if an image of someone smoking is shown. And this could be used for alcohol, because having this type of advert would ruin the movie. So they don't no longer show people smoking in movies. And this is also an interesting topic. We have potential space in relation to brief counseling, a topic that could really evolve in Brazil. And basically, we need to work on these agendas. One topic that we have really made a lot of advances on was the new tax, and it was a huge success, and also tackling of drink driving. And this is a work that Brazil is doing, and added to that, the new note gives us some guidelines to implement SAFER and also labeling, because labeling is a must for us to move forward. Thank you, João. Because we have some time constraints and we have many questions, I will prioritize one that is related to what João said in relation to the monitoring of people. Do we still have Marcia here with us? Yes, I'm here.
Tá joia, porque tem
Hi.
alguns comentários sobre
Because we have some comments about the monitoring of people who have alcohol dependence, and also a question about the damage reduction policy and the need to drastically reduce use. And I think that you, better than anyone, can help us answer that question. And then I will have to close the meeting, unfortunately.
Uma palavra? João, até eu ia ver com você da gente.
Well, João, I was even going to check with you if we could perhaps discuss SAFER a little bit more so that we can, in addition to the brief intervention, which is one of the most important strategies currently,
Eu acho que a gente precisa
I think that we need to also have global alignment and talk about brief intervention and damage reduction, because the basis both for brief intervention and damage reduction is the interview that is going to work with this entire context of already being in a specific phase or not, so that we can either move forward to cessation or decrease as much as possible the damage caused by the drugs in ourselves. And this is one of the answers that I have for the people who are hearing us. SAFER is currently part of an agenda with the Ministry of Justice and the Ministry of Health, jointly with a cooperation term that we have with PAHO. We have also worked with SENAGE, with the Drug Policy Secretariat of the Ministry of Justice. So both in the drafting of this cooperation term and also in the future, in the brief future, in the development and implementation and monitoring of this prevention, so to speak, because it's part of the SENAGE Prevention Department. Us here in the Health Ministry, in our Mental Health and Alcohol and Other Drugs Department, we are doing damage reduction initiatives, and they will be launched in March or April. That's when we're going to launch the damage reduction activities. Also, as part of a work done with Fiocruz, Eduardo, SMAGE, Fiocruz Brasília, where we are going to work with damage reduction in schools all over the country, bringing not only the phase where we need to reduce the issues that drugs may cause for us, both when it comes to alcohol and other drugs, but also achieving the cessation. And like Vital said, in the end, depending on each of our desire in terms of our relationship with specific drugs. And well, that's the work that we do, Leticia. Of course, I saw you here the entire time, and once again, I'd like to Thank you, Letícia Cardoso, for the work that you do, for leading and the entire work in orchestrating this huge team that worked with the technical note. Congratulations once again.
Obrigada, Márcia. Obrigada a todos os palestrantes,
Thank you, Marcia.
pesquisadores,
Thank you to all
que estiveram
speakers and researchers who were with us and
publicidade, digamos, né, de tornar pública
publicity.
essa técnica,
The publicity of this technical note is very important for us. This webinar will be recorded. Many people asked us to share the link in our technical note. It is in the YouTube chat. And the next steps are thinking. I wanted to share the link. You have your microphone open. Chris and Paola, please. The link is in the chat. So the next steps are thinking first about how to better communicate the message that we are bringing, that there is no safe dose, and the amount of a standard drink and its publicization in a very clear manner. We need to really work on our communication with the population, with opinion makers, with professors. We can't have health professionals sending mixed messages. This is an obstacle, and we are going to look to other partners who are competent in communication so as to expand this message. And in addition to that, we are going to work in the unfolding of this technical note moving forward with knowledge about risk consumption practices, low, medium, and high. This is an important next steps, and the girls just shared the QR code if you are interested in downloading the technical note. And in addition to that, we're going to move forward with the technical discussion about the low, medium, and high risk consumption. And this will cause us to go deeper into the scientific literature so that we can take a secure stand on this. But for now, our main message is that there is no safe alcohol consumption. Some groups like pregnant women, children, and adolescents, and people who have diseases, alcohol-related diseases, should not consume alcohol at any amount. And the unified standard drink for one drink is 10 grams of alcohol. These are the three main messages behind this technical note. We are going to work with communication, information, the labeling of alcoholic beverages with Anvisa, and a set of subsequent measures in a main challenge will be followed, as well as the setting of taxes in the selective tax and other measures that protect the alcoholic beverages environment, not only the physical environment, but the digital environment. And here we're talking about a much more complex agenda because the digital environment brings an entire level of complexity that we are actually tackling other lines of action. We can, and why did I say communication is our first line? Because it's very easy for contradictory messages, fake news, and different narratives to emerge, especially piggybacking on other topics. And it's not by chance that the alcohol industry is using female empowerment to give women autonomy to drink and to drink whatever they want. And we saw that the excessive drinking and excessive alcohol consumption has increased, especially among women. So it is a marketing that is using a current narrative to expand consumption. So we need to work with our communication very strongly. So once again, thank you all for being here. We had 200 people watching as an average, and this will be recorded. Please disseminate this technical note and the presentations that were very exciting and very informative and very high quality. Thank you very much, everybody.
Até logo, gente. Obrigada.
See you soon. Thank you very much.
Obrigada a todos. Encerramos então esse webinário.
Thank you, everyone. Thus, we conclude the webinar. Have a good afternoon, a good evening.
Recording stop.